We are going to hold the 5th Fukuoka One Health International Forum from now. My name is Yuriko Matsuo. I'll be the moderator of today's session. Thank you very much. Well, in Fukuoka, humans and animals and environment, actually the health of these three elements are just promoted as one health initiative. And then COVID-19 and the zoonotic diseases, actually we are going to have world-class researchers and sharing their information with other people to promote the One Health initiative from Fukuoka Prefecture, which have made a declaration, and this is the 5th international forum of Fukuoka One Health International Forum. So we are going to have opening ceremony, and I'll call upon Mr. Hiroaki Hasuzawa, Vice Chair of the Executive Committee, Fukuoka Prefecture One Health International Forum, and the President of Fukuoka Medical Association, to make opening remarks. Good afternoon, everyone. Thank you for the introduction. I'm Hiroaki Hasuzawa. Here we are having the 5th Fukuoka One Health International Forum. Thank you very much for joining us. And to start or to open this international forum, I'd like to take this opportunity to extend my deepest appreciation to all the people who are involved in the preparation, economy, and medical care, and others. Actually, we experience the COVID-19 pandemic, and that pandemic is not yet ended. So we are still have some cases of COVID-19 infection, and on top of that, we are seeing increasing cases of influenza as well. In order to just conduct effective preventive actions against these diseases, One Health philosophy that is important. That is the integration of the health of humans, animals, and the environment. And then actually, Heisei 25 December, Fukuoka was our first prefecture where the National Japan's Medical Association and the Japan's Veterinary Medicine Association, they decided to work together. And then also together with Professor Yokozawa, the former president of Japan Medical Association, and then Fukuoka Declaration was just issued in Kyushu some time ago. And as we saw in this morning, actually One Health education that is just offered to school students as well. So this is what we are having around One Health concept, and then prevention of diseases, and then prevention and actions against drug resistances, and Ebola and others, other zoonotic diseases. One Health philosophy is a very, very important concept, because we cannot solve these kind of health-related problems alone. So the collaboration and the alliance with other or among different groups of people, that is indispensable. So One Health philosophy, and then the promotion of the awareness of One Health concept. We would like to work together with many different organizations to promote this concept and spread out the messages of importance as well. And then I expect you to join this initiative as well. And today's forum, actually, the enriched future with One's Health. That is a total theme, and we are going to have a special guest from WOVA, Dr. John D. John, and from WOAH, Dr. Mark Ship, and from CMAAO, Dr. Maria Minerva P. Kalmag. We are going to have keynote lectures by these prestigious lecturers. And I hope this opportunity would be given to you to think about One Health concept furthermore into the future. So that's all. Thank you very much. Thank you very much, Mr. Chairman.
Next, on behalf of the organizers, I would like to call upon the President of the Executive Committee of One Health International Forum in Fukuoka, the Governor of Fukuoka Prefecture, Seitaro Hattori. Hello, everyone. I am the Governor of Fukuoka Prefecture, Seitaro Hattori. I would like to thank you all for attending the 5th One Health International Forum in Fukuoka today. I would also like to express my sincere gratitude to all those involved in organizing the event. We are going to connect us to the site of the break-in, which is an epoch-making. And I would like to extend my heartfelt appreciation to President Hasuzawa of the Fukuoka Medical Association and President Kusaba of the Fukuoka Veterinary Association. And also we have the honorary guest, Dr. Yokokura, Honorary Chairman of the Japan Medical Association, and Mr. Kohara, the Chairman of the Fukuoka Prefecture Assembly, who have all shown deep understanding and great support for our prefecture's efforts to promote One Health. I would like to take this opportunity to express my sincere gratitude. For 3 years and a half, for a long duration of the impact of the pandemic, the COVID, we have suffered from it a lot. We were in danger of losing our lives. And the social activities, economic activities have been heavily impacted. Or actually, the COVID is gradually being converged, but it's not gone 100%. It's not extinct. And the infectious diseases, well, 60% of which are derived from animals. So these are really the zoonotic infections. So vicious virus might emerge anytime. We can't predict it when. And the bird flu, well, this year just happened that we didn't have the eruption bursting out of the bird flu, but some farms had to, sacrifice over 1 million birds in some cases. Then, as a result, the prices of eggs would plummet, and as a result, our livelihood would be affected heavily. The people's lives are heavier than the weight of Earth. That's many people say. I know Japanese version of CDC in Japan is to be launched this coming spring. The response to those infectious diseases have to be correctly taken, but before it happens, we really have to take measures, precautions, not to not allowed to allow those infectious diseases would happen. So, medicine, the veterinary, and pharmacy and environment from many different approaches in a scientific manner will be necessary. So, on this global forum of the top-level researchers of the world have gathered all here to discuss on the issues of One Health and then disseminate the discussed information to the rest of the world. Now, so the theme of this forum is opening up a prosperous future through One Health. Now, John Deon, President John Deon, the World Veterinary Association, and also former president of WOAH, Mark Ship, and also Maria Minerva Kalmag, president of CMAAO. During their very busy schedule, they have been kind enough to come to Fukuoka. Those renowned researchers and professionals are to give us lectures for which we feel really appreciative. And I'm sure that this forum for not just Fukuoka Prefecture citizens, but also for the people all over the world, bring about fruitful results. Ladies and gentlemen, this blue, beautiful earth should be handed down to the future generations. That's our responsibility. Please, in your daily lives, from where you can, please practice One Health. Thank you very much for your kind attention.
As Governor Hattori mentioned, we are now connected to the Breaking World Match 2025 venue, which is being held in Kitakyushu. Yes, Governor, if you could please move forward onto the stage where there's a red mark. Mr. Maluk, hello, Governor. Thank you. Nice to meet you. My name is Maluk. I am a coach and manager of the Japanese team, as was introduced. I am at Kitakyushu Performance Arts Center for the Breaking World Battle, the Japan-Korea battle. We just have to we have Ayane and the Korean counterpart are in match. And please look at the video. This is about the first battle. Shigekix and Ayane, the brother and sister, are the champions. In Olympic Games, there were only one-and-one battles, but this competition format includes team battles, and which has become very exciting. Oh, that's wonderful. Thank you. I understand that you have an exciting event going on. As I introduced to the audience here, in this world match, I understand that the operation is carried out based on the One Health principle. Can you speak on that, please? Yes, exactly. The athletes have suffered greatly for COVID, and we introduce the initiatives of One Health to practice, starting from whatever we can. For example, plastic bottle collection boxes have been set up to reduce plastic waste, and drive food collection boxes have been set up to encourage visitors to bring in non-perished food items. We also have a One Health philosophy introduction corner. Usually, lunch boxes are provided to the staff and athletes, but sometimes you have excessive food boxes left. So we provide instead meal tickets to athletes and staff so that people can enjoy eating at any time they want in the amount they like, and people can all enjoy delicacies from Fukuoka. Thank you. Athletes and the event staff are collaborating together for One Health. I'd like to thank you all. So you can start One Health principle from wherever it is possible. This morning we have Mayor of Koga with us. I took part in the campaign of cleaning up the beach of plastic garbage. And last year at the Nations League of the Volleyball Food Loss Initiative was conducted with the meal coupons. Thank you very much for your efforts. We have lots of delicacies in Fukuoka together with the One Health promotion. I do hope that you would also promote the good food in Fukuoka. Yes, of course, we will do that. Japanese athletes and Korean athletes, they all support this One Health initiative. Yesterday, everyone was practicing here, and we have some comments from the players. So let us show you some of the comments.
스포츠를 통해 건강과 행복을 증진하고 싶다는 원헬스의 이념에 동참하고 우리도 앞으로 행동으로 실천해 나가겠습니다.
수년前
Activities was limited because of the COVID. We would like to promote the principle of One Health so that this will not be repeated. Last week in Tokyo, All Japan Championship was held for breaking. As our federation, we also carried out some One Health initiative, and please look at the video for that.
2月14日から16日まで渋谷で開催された全日本ブレイキン選手権においても競技団体としてワンヘルスの推進に取り組みました。会場内で選手への啓蒙活動をはじめ、選手、スタッフのペットボトルでの水分補給からマイボトルへの使用へ移行をしました。この取り組みの成果として大会後のゴミの量を 30% 削減することができました。我々日本ダンススポーツ連盟としてはこれからもワンヘルスの推進に取り組んでいきます。
小倉長。いやもう本当に
Thank you very much. I can see that you are promoting One Health philosophy. Not only that, you are actually implementing the activities of One Health, and thank you very much for that. Well, in fact, in the Paris Olympic Games, this Hiroten was very active in the Olympic Games, and he is here with us. You just completed your first battle, you won the battle. Governor Hattori, can you give us a message? Yes. Hiroten-san, I will join you later. I will come to your venue soon, so let's look forward to meeting you. Thank you very much. All the athletes and staff, please send our remarks to Terauchi-san, who has been instrumental in teaching us. Thank you very much. Yes, thank you, and hope you would have a good luck. Thank you. Governor Hattori, thank you very much.
So next, we would like to ask some distinguished guests to kindly say a few words. First one, Dr. Yoshitake Yokokura, Honorary President, Japan Medical Association. Good afternoon, everyone. Thank you very much for the introduction. I'm Yoshitake Yokokura, Honorary President, Japan Medical Association. here we are having a 5th Fukuoka One Health International Forum. It is a great pleasure for me to say a few words in front of you. And also Fukuoka Prefecture staff, and then Fukuoka Medical Association and Fukuoka Veterinary Medical Association. I would like to just thank all these people as well. And then Professor John Deon, Dr. John Deon from MWA, and then Dr. Mark Ship from WOAH, and Dr. Maria Minerva Kalmak from CMAO. Welcome to Japan and Fukuoka. I would like to extend my heartful welcome to all of you. And then now, breaking Ikita Kyushu that was introduced. I didn't know what this was. Well, actually, that is a kind of dancing, and then that kind of event has been drawing a lot of attention from the Paris Olympics Games last year, and I believe that you are familiar with this kind of event very well, much more than me. And then 2013, when I served as a president, actually Dr. Kurauchi just was appointed as the president of JVMA, and we had a talk a little bit, and then we just agreed that this was a very good opportunity to work together. And then 2012, actually, the WMA and the WBMA, actually, there was some just agreement in order to promote One Health philosophy. I was attending that event, and then I thought that it was a good idea to promote the philosophy of One Health in Japan as well, and that should be quite important to just develop next futures or next generation of people. And then at the same time, we agreed to just sign the co-working or collaboration agreement between Japan Medical Association and the Japan Veterinary Medical Association. And then we have been quite successful in promoting this concept so far. So pandemics or infectious diseases like COVID-19, actually we suffered a lot in this pandemic, but infectious diseases, environment problems, and the coexisting with animals, there are a lot of just worldwide issues, and the One Health concept is quite important, critical to come up with just solutions. The climate change and the zoonotic diseases, and then changing ecosystem. There's other kind of circumstances, a good balance and the optimization of health of humans and animals and environment. That is what we have to just pursue towards the future. And then Akita Kyushu and this particular area of Japan that has been quite active to have an international just exchanges, and then just taking initiative and the leadership in promoting this kind of concept as well. So this particular place is very good at and strong at having this kind of event. So now we are having this event together with you, and I expect a lot more of you and the people living here. In this morning, we heard some presentation given by the high school students with a focus on One Health activities. Actually, I was amazed that their activities are quite at a high level with a concept of just One Health. And you may have been just attending the exhibition session as well. Actually, their activities are quite high in terms of the just techniques or methodologies. And then they also want to get younger students and children involved in the One Health initiative as well. And the last year, well, actually, I was involved in studying of the Japan Risk and Crisis Management Society, And then actually we had our first general meeting of the society in Fukuoka as well. So risk management and danger management from that perspective as well, together with disease control and others, we need to think about the issues or problems related to humans and the animals and the impact of emerging diseases or recurring diseases. We shouldn't forget what we have experienced. Oftentimes people say that Japanese people are a little bit forgetful of what happened in the past, but we need to remember what happened, what we experienced. I think learning through the past experience, that should be a very important critical theme towards the next generation. And so sapiens, actually the humans are Homo sapiens, but sapiens means intelligence, and how to just maintain humans as sapiens, that means existence with intelligence. I think that is a theme of the society we started as well. So this forum should be quite helpful to just be conducive to the promotion of well health, and I hope you to learn something through the presentations we are going to hear today. And then lastly, but nevertheless, actually Mr. Inoue and then Mr. Hanako Jimmy, and I would like to thank all these distinguished guests to be together with us here in this venue. So that's all. Thank you very much. Thank you very much, Dr. Yokokura. And then from Fukuoka Prefectural Assembly, I would like to call upon Mr. Katsuji Kohara to kindly say a few words to us. Mr. Katsuji Kohara is a chairman of the Fukuoka Prefectural Assembly. Good afternoon, everyone. I'm Kohara, chairman of the Fukuoka Prefectural Assembly. Well, Dr. Fujimaru and Dr. Inoue and Jimmy Hanako, and then Mr. Harauchi and Mr. Tokuhiro, governor of Kagoshima, and then also the regulatory committee members, particularly president and the vice president. They are with us today, and then actually these distinguished guests are just sitting there on the top of the stairs there. And here we are just having the 5th Fukuoka Prefecture One Health International Forum, and congratulations. And Mr. Hattori and Mr. Hasuzawa, congratulations. I would like to extend my congratulations to these people, and Dr. Yokokura and others. I would like to just extend my respect and appreciation to all these people who have been contributing to this particular event. And then also Dr. Kurauchi, unfortunately, he is not available today, but he said to me that he wanted to extend his appreciation and then the gratitude to you, and also he felt very sorry not to be with us. But together with the governor, Mr. Hattori, we have been just promoting One Health in Fukuoka Prefecture, and the one important message or the mission we want to do is to just promote, disseminate this concept throughout the younger generation, including school students and others. I think that is the first step we wanted to take. And then the the president and chair and the vice chair of education committee, municipal education committee, they are just joining this meeting as well. But nobody was just available or qualified to just teach One Health concept to students. And so in the past 5 years, we were trying a lot of things and struggling to develop trainers or instructors first for One Health concept promotion. And then actually we are now seeing the result as we did in this morning with the presentation by a high school student. And you may have noticed in this morning that One Health concept is not a difficult one. We can find the concept of One Health in every corner of everyday life. I think that is one of the comments I heard in this morning, and I totally agree. One Health. I think everyone should be just feeling that One Health is their own, each individual's own issues. And then through today's lectures, we are going to have lectures from Dr. Dejon and Dr. Mark. And so Dr. Dejon, President of WVA, and Dr. Mark Ship, former President of WOAH, and Dr. Maria Minerva Kalimag, President of CMAAO. So we are going to have quite valuable speeches from these people. And I understand that it is not easy task to just disseminate this message of One Health, but through the presentations or lectures by these world-class researchers, we would like to learn more about One Health and how to promote this concept. And then some people may say that we may put too much focus on One Health, and some people may feel may have a negative just feeling about One Health. Actually, some part of the media, but we are proud of promoting this One Health, and that is very critical to develop next generation of people, and then that should be just well recognized in the community as well. As Mr. Governor Hattori said before, the Fukuoka should be one of the hubs to just promote One Health concept or philosophy. 26, Professor Kurauchi, Dr. Kurauchi, going to just be the president of World Veterinary Medical Association, and then the next meeting of WVMA is going to be held in Tokyo. So I think that should be a big forward step in Japan to promote One Health philosophy. And then 2028 in Fukuoka, World One Health Congress. We hope to just have that event in Fukuoka 2028, and now we are working together with Governor Hattori to just successfully just achieve achieve that event or bring that event to Fukuoka. So we are members of Team Fukuoka. As a one single team, we would like to just promote One Health concept, and also Fukuoka should be the hub of that. And then by asking for your further support and cooperation, I would like to end my speech. Thank you very much. Thank you very much, Mr. Kohara.
We have the MP Hanako Jimmy, Takahiro Inoue, and Satoshi Fujimaru are present. And we have received the congratulatory telegrams, and due to limitation time, I'm going to share with you the name of the persons who have said Ms. Hanako Jimmy, Takahiro Inoue, Satoshi Fujimaru, MPs, and Makoto Onike, Atsushi Koga, Satoshi Oiya, Toshio Matsuo, the chairman of the LDP and Fukuoka LDP, and also Iwami Haratake, and also the mayor of Dazaifu, Daizo Kusuda, Mayor Yame, Yutaro Inohara. That's all. These are the people who have sent these congratulatory telegrams to this event. Thank you very much.